Hi everyone, Dr. Jeff back from Costa Rica. Hope you enjoyed the videos last couple weeks with co-op student Leiann here. She did a great job, and this week, what are we going to do together this week?
This week, I thought for your first week back from vacation, we talk about bursitis.
What is bursitis?
Bursitis, well, let's first talk about what a bursa is.
Okay, what's a bursa?
Bursa is a fluid-filled sac, and it's found between your tendons and your bones, and is usually surrounding a joint in your body. And the bursa acts as a gliding mechanism between your tendons and your bones to reduce that friction whenever you're going through range of motion, you're performing some activity. And yeah, so what's bursitis?
Bursitis is what happens to the bursa sac. Something happens to it and it gets angry and it swells up like a balloon. And because it swells up and gets bigger, it causes pressure on the tissue surrounding it and causes pain.
So the causes of bursitis can include trauma if you fall on the bursa, such as falling on your elbow. It can also include inflammatory diseases such as inflammatory arthritis. It can also come about from overuse if you continuously perform a certain motion. And it can also come about spontaneously. We may not know the cause of bursitis.
Well, what happens when you get bursitis? Well, the one thing you need to do is get it diagnosed properly. So come in and see your family doctor or see us, see a physiotherapist and get it diagnosed. There's certain things that we look at to diagnose a bursitis. Once we know what's a bursitis, then there's things we can do for it. What you can do is you can put ice on it because that's going to reduce the inflammation. You can rest it, so stop doing the activity that caused it. Try not to fall on it again. The most common areas you're going to find bursitis is in your knee, in your hip, and in your shoulder. You can get bursitis other places, but those are the three most common areas you're going to get it. So rest and ice is what you can do at home for it. What we do here for you is we find that ultrasound and laser work really well on bursitis. If it's really, really hot and quite large, you can find, I've seen people come in, especially hockey players come in that fall on their elbow and they didn't have their elbow pad in place, and it comes in and it's a sac of fluid. It actually swivels around like this. You can push it around and it's almost like a little wave in there. So if it's like that, we can put some stim on it. You can also, if it's really, really bad like that, you can aspirate it. So what they'll do with that is they'll go in with a needle and they actually suck the fluid out of it. The problem with that is that when you go in, could introduce infection into it. That leads to even further problems. They could also miss it and they don't get anything out at all. And lastly, if it's really not coming along with ultrasound and with our icing and everything else, they can do cortisone. Cortisone is kind of a last choice to get it done. It does provide a great anti-inflammatory to it, but again, if they don't hit the right spot, they can cause more damage than they did with the bursitis. Also, risk of inducing infection into the joint, and that causes more problems in the joint. So cortisone is kind of the last resort.
So we hope you liked the video today, and if you did, please give it a thumbs up, comment, subscribe, and share with your friends. And if you have any questions, feel free to email us. And if you have anything you want me or Dr. Jeff to talk about, feel free to leave it in the comments or email us that as well. And as always, here at Goldsworthy Chiropractic, we got your back.